Hello everyone, this is Dr. Kusuma from Suria Cosmetic Surgery. Again, sticking to my promise, I'm drawing it myself, I am doing it live, and I want to make sure that everybody understands that I'm not a bot. This is not AI generated stuff. This is human generated stuff. You're a plastic surgeon, okay? So this video, I want to distinguish my definition of what I call a mini abdominoplasty or an abdominoplasty, because this comes up periodically. Although I focus a lot on the face and breast, there are some patients who also come in to do some abdomen work here and there, and I do a fantastic job of it. But I wanted to explain that portion of it again because I saw a consult this morning and the difference of an abdominoplasty and a mini abdominoplasty came up. I think every surgeon probably has their own definition. I'm sure a textbook has its own definition. But in plastic surgery, one of the beauties is that you can define what your definition is because it's an extraordinarily creative field, and that's one of the reasons I love it. So in my practice, I define a mini abdominoplasty and an abdominoplasty slightly differently. And in a traditional abdominoplasty, there are typically about three things done. Okay, one is to remove the extra skin of the abdomen. So this is the abdomen, this is the belly button in the center. These here are the muscles, the six-pack muscles that we talk about, the rectus muscles here. This is the belly button right in the center here. Okay, this is the waist where the incision typically goes. But there are three things generally done in an abdominoplasty. The extra skin is removed and the incision is placed at the bottom and sutured together because you removed all that extra skin. That's number one. So skin excision. Number two is muscle tightening. Okay, so this muscle in the center, this is the six-pack muscle, this is the other six-pack muscle. These are the oblique muscles on the side, the front and the side. So with pregnancy or with surgery in the past, or a lot of intra-abdominal fat or weakness for various reasons, aging, the central part can separate because there's no muscle in the middle right here. This one six-pack muscle, this other six-pack muscle called the rectus can have what we call rectus diastasis, where it spreads and stretches out. When that happens, you also can tighten by suturing the central part here. That's called muscle tightening. That's the second thing that happens in an abdominoplasty. The third thing that happens is lipocontouring. So when there's excess fat in the flank area here, like I drew, or somewhere in the abdomen, you can also contour it by removing the fat, almost contouring it, just like removing the skin and muscle tightening. You remove the fat and you do that. So those are the three steps in a traditional abdominoplasty that most surgeons do. In a mini abdominoplasty, in my definition, again, like I said, I'm very upfront to say that other surgeons maybe do it differently or define mini abdominoplasty differently, but to keep it practical in my practice, I do not do this part in a mini abdominoplasty, and many times patients who need a mini abdominoplasty don't even need this part. So most of this is skin excision in a mini abdominoplasty. So abdominoplasty has three steps. A mini has one or maybe two steps, right? So skin excision and maybe some contouring, but not too much like in a traditional abdominoplasty, right? So that's the main difference in the amount of work that's required in my practice to do a mini abdominoplasty or a regular abdominoplasty. A mini abdominoplasty can really be done under IV anesthesia. Some surgeons do the traditional abdominoplasty also under IV anesthesia, but I typically tend not to because I want the abdomen and the muscles to be completely relaxed, and therefore we have to give some medicine for that to happen, and therefore I can do a very, very thorough job, because if they don't have that relaxation, the muscles will be tense and you can't get a good tightening of the muscles. So for that reason, I typically do an abdominoplasty under full general anesthesia with the tube and all that at an outside surgical facility. In a mini abdominoplasty, however, because there is no muscle work involved and some minor contouring, I prefer to do them under IV sedation, which is a very, very easy way to do, because it's mostly removing the skin and creating the belly button so the belly is flat, where that, a pouch of skin that hangs below the belly button looks ugly and most people don't like it, so we remove that. So that's the working definition of Dr. Kusuma Suria cosmetic surgery, mini abdominoplasty versus an abdominoplasty. I hope that helps you. Thank you so much.